Well, good evening, everyone, and welcome to the first in our series of three on healthy aging. I'm Kevin Kell, Oxford College 75, Emory College 77. So I fall squarely into that 60 plus alumni cohort, no doubt about that. I have the pleasure of serving as the Alumni Association liaison to 60 Plus Network and also to Society of Corpus Cordis Aureum. Many of you have joined us before, but if you haven't, 60 Plus Network was launched in the spring of 2020, just before everything went off the rails. And despite the stress of COVID, this ambitious bunch of board members mounted 14 monthly digital events on topics ranging from the educational to the intellectual, to the cultural, to just plain fun. 2022 is shaping up to be another robust year of programming. And at some point this year, we really hope to be able to get together in person for a social event. In the meantime, continue to watch your mail for notices of upcoming events. And I hope you'll join us on February 25th for the second in this series, when we partner with Society of Corpus Cordis Aureum for to hear Dr. Alan Levy of the Goizueta Institute at Emory Brain Health talk about how preventive medicine or personalized medicine is becoming a treatment option relative to degenerative brain diseases. We have a special treat this evening with Dr. Mary Lambert. I got to know Mary when we both served on the Emory Alumni Board a few years ago, and she's going to talk about some of the best practices for healthy aging. I'm going to let Linda Smith, board member, introduce her because Linda introduced Mary to us. So without further ado, Linda, please introduce Mary.
Thank you so much, Kevin. I'm truly thrilled to be able to introduce the marvelous, as I say, Dr. Mary Lambert. Mary's long experience in community and public health leadership is listed in her very impressive 19-page CV, but since this is a 60-plus age group, allow me to give you the Reader's Digest condensed version of Mary's qualifications. Dr. Lambert received her BS in nursing from the University of Tennessee, her master's in nursing from our beloved Emory, and a doctorate in nursing practice from Vanderbilt. Mary's impressive international work experience ranges from the Veterans Administration to the U.S. Army's Nurse Corps to the Department of Health and Human Services and the Centers for Disease Control. Her knowledgeable footprint has been left in notable locations globally, including the White House. Now she's teaching nursing at Vanderbilt on the side, while she has a full-time job of spearheading the COVID response for the mayor of Chattanooga, Tennessee. Dr. Lambert has served Emory well through the years, including time on the School of Nursing Alumni Board with a term as board president. I had the pleasure, as we said, of serving with Mary and Kevin during Mary's 2 terms on the Emory Alumni Board and have been graced to call her a smart, kind friend for many years. Thank you all for joining us today to hear Mary talk. Take it away, Mary.
Thank you so much, Linda, Kevin. I truly appreciate the opportunity. Emory is so near and dear to my heart. I can say that the name Emory, that name has carried me places just because folks, considering my appointment to their organization, will often see that Emory University in my background and are most impressed. And in addition to the fact that the education that I received at Emory on the master's level, the wonderful friends and colleagues that I still have there, as well as my time in Atlanta during 2 active duty assignments at the Centers for Disease Control and Prevention. So it's really a pleasure to be here. And I'm truly committed to the Emory Alumni Association and all of the Emory alumni as I am to Emory. With that, I did want to speak with you this evening, and I would like to make this as informal as possible. And a lot of this may be refreshers to individuals. Most of the time when I speak, I have some idea of the background of the audience. So I'm not sure whether I'm speaking to physicians, nurses, physical therapists, PAs, I'm not sure who I'm talking with. So some of this information may be what you know already, but some may be information that's either new to you or reminders. And I think that's always a good thing. I'm always appreciative of getting reminders of information to keep me healthy. So in pursuit of healthy aging, because truly the best can and should be ahead. May I have the next slide, please? Thank you. Very much appreciate that. My challenge is that I'm using two different software packages in my work with Vanderbilt and in my work with the city and the appointment with the mayor. So I appreciate the support and the assist with my slides this evening. In pursuit of healthy aging, I've got a few goals for this webinar, and we look forward to your questions at the end. We want to describe just a little bit around the demographics related to older individuals, older Americans. We want to identify the challenges to health for older Americans, older individuals. We can consider some opportunities to maintain and maximize the health of older individuals. There's a wealth of those, but we'll go over a few of those. And then briefly, because of the times we live in now, we do need to overview COVID-19, where we are now, and what may be next. Next slide, please. In pursuit of healthy aging for older Americans, just a bit about some demographic information. As I believe we all know, especially given our age bracket, America's older population does continue to grow rapidly. This began in January of 2011, with more than 10,000 Americans reaching the age of 65 each day. That has ramifications for absolutely everything, but it in particular has ramifications for the health that we need and the health and the demands that are being put on and will continue to be put on our healthcare system. It is estimated that this trend is going to continue until the year 2030, so we have a ways to go. And some of you may have heard these terms to describe America's aging population, these terms: graying of America, the silver tsunami, the gray tsunami, the gray tsunami. I've got that repeated, sorry about that. Next slide, please. Now, some of the indicators of health status for older Americans, and these are things for those of us who may have had some clinical practice or who may have experienced this in their physical or visits to their healthcare providers. I know when I have my Medicare physical every year, all of these areas are touched and then some. The number of physically unhealthy days each month. I mean, that's something that we all should track. Because there may be some things that we need to address a little more closely with our healthcare provider. Frequent mental distress. And I think many of us have a lot of that during this pandemic period. And we may have that just in general because of losses, because of children growing up and moving away, being alone when one's not used to being alone, changing or moving away from working full time, just many areas to cause us some mental stress. Oral health is another one of those indicators. Existing disability, the amount of leisure time, physical activity each month, more is better. We sometimes have a tendency to get a bit more sedentary as we get older. Not all of us, but some of us do. And we need to pay attention to how much leisure time, physical activity we engage in each month. Our patterns of food consumption, sometimes our appetites wane, sometimes we change what we eat. So that pattern of food consumption, very important. If obesity is an issue, that's an issue that does need to be addressed, paid attention. We need to pay attention to that. Current smoking, I think it goes without saying what a health risk that is. And then whether or not an individual is on high blood pressure medication. Hypertension is also associated with accelerated brain aging. Even elevated blood pressure that's within the high end, that's within normal range, but it's on the high end of normal range. And that may be something that a future speaker can or will address and go into a little further, more extensively. Whether or not the individual has another, these are more indicators. Most of these next few are related to vaccinations. Flu vaccine in the past year, shingles vaccine, the tetanus vaccination, and that one needs to be given every 10 years or more often if there's been an injury. The pneumonia vaccine. All of those vaccines are incredibly important. And what I didn't add to this list, because we're going to talk about vaccinations and et cetera related to COVID in the latter part of this presentation. For women, mammogram within the past 2 years. Women often are seen deferring or not caring to have that mammogram as they get older. It's still very important as we get older, and it's an indicator of health status for older Americans, for older American women. Colorectal cancer screening, very important. The age, depending on whether or not there's any family history, but certainly a very important screening that needs to happen on the recommended timeline. And then whether or not, and the first time I got this question during my first, the time when I got this question at the time of my first Medicare physical, falls, and the question was asked more than once as to whether I'd had any falls within the past year. But it is something for us to be very aware of, cognizant of, and report whether or not that happens, so that there can be some assessment as to what may be going on, whether it's physically or whether it's environmentally. Thank you very much. Some of the nutrients of concern for older individuals, and I'll just name a few of them in this slide and the next slide. Water. Due to decreased thirst sensation and other factors, fluid intake is incredibly important for older adults, so that water consumption becomes very important. Calcium, the intake of calcium is often below the recommendation for people over the age of 70. Eating 4 servings of dairy products or other calcium-rich foods does help with meeting this recommendation. I think we often don't pay attention to what nutrients might be in the food that we're consuming. Vitamin B12. Americans 50 years and older usually consume adequate vitamin B12. However, many people 50 years of age and older have reduced ability to absorb. So there's probably a need to increase the intake of foods, nutrients with the vitamin B12. Vitamin D, this is a unique vitamin in that you can, that sunlight on the skin enables the body to make vitamin D. I know there's a concern about overexposure to sun and for issues related to skin overexposure to sun, but it's still a very good source of vitamin D. But there's also vitamin D in foods, as well as vitamin D in supplements that we can take. Next slide, please. Now, healthy eating, there's so many tips for eating healthily, for healthy eating for older adults. It's recommended that we eat with other people, especially if one lives alone. This usually makes mealtime more enjoyable and thus stimulates appetite. I do have a 93-year-old mother, and we notice, all of her children notice that she just eats, her appetite is so much better, and she eats so much more of a healthy meal if she has company when she's doing that, as opposed to eating alone because she lives alone. Preparing food can sometimes be a bother or chore. So preparing large amounts of food and freezing some of those or storing them for heating up later or using later saves time for cooking, and it'll encourage and support eating the best kinds of meals each day. eating regular meals. If meals are too big, too much, eating small amounts, whatever it takes to get the foods in that you need during the day. So increasing the frequency of eating if you need to take smaller meals is a great tip for healthy eating. Going to the supermarket is a bother. Then going at times where there'll be less traffic, less individuals in the store. And that's especially important during the pandemic period. In fact, many grocery stores open super early for folks to go in, older folks to go in early so that they're not exposed to as many people. And it's just not as busy to get through the grocery store experience. And then utilizing unit pricing, sales, and coupons to cut back on the expense. We all try to watch our expenditures, our budgets. So those sales and coupons, that kind of thing, does help with with managing our budget around the foods and making sure that we get the foods that we need to remain healthy. Next slide, please. Some additional tips, a couple of additional tips. Taking advantage of community meal programs for older individuals, such as Meals on Wheels and meals at senior centers, or with groups of friends that one can engage in, socialization, and that really does support appetite as well. So taking advantage of community meal programs and opportunities to eat with groups of individuals. To perk up sluggish appetites, the nutritionists that I work with are always suggesting, and I know that to be the case, the use of herbs and spices, lemon juice, vinegar, garlic, and others, whatever your preference is, just to perk up a sluggish appetite. Next slide, please. Some of the meal planning tips for older Americans, some things for you to consider. Moderately sized meals and half portions. It's a good idea for all of us, and actually whatever age, but in particular for older Americans. Emphasizing higher fiber foods such as fruits, vegetables, whole grains, beans. So emphasizing those kinds of foods for the fiber that we need and the other nutrients in our diets. Moderating the use of fat. Many older adults do not like to see an entree swimming in a pool of butter or any other kind of fat. So just moderating use of that fat, whether you're cooking for yourself or for others, just to make it more appetizing. Dairy products such as milk and yogurt are such important sources of calcium. I do know that some individuals may have a lactose intolerance, but there are certainly other sources of calcium from which to get calcium, and also vitamin D. Adequate protein, but not too much. And using a variety of both animal and vegetable protein sources. There is a need to moderate the use of salt and salty ingredients. And again, the use of herbs and spices does make food much more flavorful and palatable for individuals, so that they are getting so that you're getting the food that you need for your nutrition. If chewing or swallowing is a problem, and it is for some individuals, softer foods can be chosen that provide that well-balanced diet. Next slide. And here's some suggestions for food shopping, selection, areas to consider related to those choices and options. Fresh foods are always a great option. Canned foods can be a good option, but I'm going to have to emphasize over and over again the need for label reading. I probably take, and many people probably take, more time in the grocery store, wherever they're shopping, to read labels, just because we're looking for the nutrients, all of those extra additives that might be there, the amount of sugar, salt in those. So label reading, incredibly important. Frozen foods, Often you can find them, but again, you need to read the label. We have to read the labels even on frozen foods, because I am finding many of those frozen foods do have added ingredients. Depending on the method used for freezing, there is often not a need to add ingredients so that you get the food, and it's almost as good as the fresh food. Processed foods, reading the label. We just have to emphasize reading the label. I've been known to go to the grocery store with a magnifying glass, just because sometimes the label, the writing on the label is so small that it's a little difficult, just to make sure that I know what I'm taking out of the grocery store for both myself and my mom. And then fast foods, look for or ask for nutrition information. I am pleased with the way that many fast food establishments are posting their nutrition information. And if they don't have it, it's always available. I haven't seen a case where it's not available on their website. And then paying attention to the serving size and the package in your food shopping and your selection. Next slide, please. In food preparation, for those healthy meals and snacks, there are also some options and choices. Raw and uncooked is always a good, if depending on whether or not you can tolerate a lot of that, but raw and uncooked foods are always a good choice. Vegetable salads, but you have to watch the type and the amount of the dressing, because I must tell you, there's quite a bit of, I've gotten quite a few surprises in reading the label of the dressing. Perhaps making your dressing from scratch, making it fresh is a good idea, because then you know exactly what's in it. Baking versus frying. And if you're frying, think about the choice of oil. If you're sauteing, think here also about the choice of oil. With sauces and gravy, think about the ingredients that may be in the sauce and the gravy, sodium, other ingredients that may not be the best choices for you. Again, making those from scratch is also a good idea, because you know exactly what's in it, how much salt, or if there was salt in it at all. Healthy meals can also be enhanced with those seasonings that we mentioned before. And then being very cautious with the addition of salt, sugar, or fat in what we prepare for ourselves and others. Thank you. In pursuit of healthy aging for older adults, older Americans, there are some areas that we all need to consider and to reassess periodically. Our fitness and exercise levels. How much exercise are we getting? It can be walking. Of course, it's going to change as we get older, but it's still possible, and it still adds to our successfully maintaining our health, our weight, whether or not there's an issue of obesity, gut health, smoking and tobacco use, including secondhand smoke. Where are we? Are we in areas where there might be secondhand smoke? Alcohol use. There are studies that indicate that there's some benefit to very, very moderate use of alcohol. But alcohol use should be one of those areas that we assess and reassess, just to see where we are, and be very forthcoming with our healthcare professionals when we have that physical exam every year, or however often you see your provider, just so that they can do the best assessment and provide the best care for you related to any smoking issue, levels of alcohol use, as well as your stress levels, and then your mechanisms for stress management, regardless to what that stress, the source of that stress is in your life. Rest and sleep. We often need just a little bit less sleep as we get older, but we may need more rest. So we need to make sure we're balancing that and how much are we carrying. I'm probably talking about myself here now because I am working part-time at Vanderbilt teaching and have taken on a full-time an appointment with the city of Chattanooga. So I'm being very, very thoughtful and probably spend too much time talking about it, but my provider, when I had my physical in December, was very pleased to hear me talking about my questions about, okay, now how much sleep should I be getting and how do I feel when I wake up and how long do I last during the day before I get really tired, that kind of thing. So rest and sleep, incredibly important in our pursuit of health. Continued social engagements and our spiritual needs. As we get older, you know, we move, you know, people move, children grow up, start their own families, move away. We have losses due to deaths. And so, you know, our social engagements may change, some shifting. So we need to be really mindful of what's going on in that area as well. And then, you know, as we get older, we do often find ourselves in a situation where we have multiple chronic medical conditions. And while that in itself can be some of the stress that we're dealing with, it's manageable. And again, a good relationship with our healthcare providers so that we can talk through where we are with all of those, with multiple medical conditions. Thank you. And for your consideration, one of the things I like to talk about is, if you have not considered it before, the benefits of whole foods and a plant-based diet. Benefits include your weight, managing your weight, your general health status, your heart status, your blood pressure, cancer prevention. We could probably do an entire series, and I would recommend that, on the benefits from a whole food plant-based diet in heart health, in cancer prevention, in the prevention of cognitive decline, and for the good of the planet. I can make some recommendations as far as some folks who could really talk through all of those areas where a whole food plant-based diet would be of great benefit to our health as well as to the health of our planet. Next slide, please. There are some food selection considerations for a whole foods plant-based diet. Basically, minimizing processed foods, the exclusion of refined foods, and the attention to food quality. Those three items will cover most of what you need to look at or to think about whether or not a whole foods plant-based diet is an area you'd like to take, you'd like to explore. Minimizing processed foods, incredibly important because of how foods are often processed. And the fact that often those processed foods are not the best for our health. The exclusion of refined foods. Often the refined foods lose nutrients that we absolutely need to maintain our health. And then paying attention to the quality of food. And unfortunately, that may be dictated by the area of the city that we live in, and whether or not there are good quality choices of food in the grocery stores in our areas. Next slide. Now, the benefits of that whole foods plant-based diet include weight loss, managing our healthy weight. If you're at a healthy weight now, that's going to help you to maintain that. Preventing diseases, either preventing the onset of disease or preventing the worsening of a disease so that you are stable. Cancer prevention, preventing that cognitive decline that we talked about, managing and or reducing the risk of diabetes. And again, that all important for all of us, the benefits for our planet. I'm getting more and more fascinated with that aspect of how doing things that are a benefit for our planet also impact our health. So it's a two-way street on that one. Next slide, please. Now I'm going to move on to just spend a few minutes talking about the COVID-19 pandemic, now what may be next, and staying healthy during this pandemic. I will confess that most of my work these days is focused on all things COVID-19, the pandemic. How do we get out of it? How do we stay safe? So I'll tend to spend a little more time on this. My webinar tomorrow is all COVID-19. So it's nice to talk about some items related to how we can stay healthy, how we can help ourselves stay healthy. But related to the COVID-19 pandemic, this virus, the virus and its variants, the virus was initially being called a novel virus. Well, it's not so novel to us now, but this virus and its variants are presenting challenges to us that we never thought we would see again. Never mind that we did have the flu pandemic a little more than 100 years ago, but it absolutely is creating some challenges for us that we need to be mindful of. The numbers to date have been staggering, just in the United States, in the state of Tennessee, where I am, and in the state of Georgia, where I imagine many of you are. Fortunately, about a year in, we got vaccines approved, and the uptake of vaccines initially was absolutely great. And I think we all should, as older individuals, older Americans, I think we should congratulate ourselves because our numbers are pretty good as far as the percentage of those 65 and over who are fully vaccinated. Those numbers are quite good. But again, remember those vaccines are not 100% protective against a breakthrough COVID infection. As a matter of fact, with the latest variant, Omicron, we are seeing more of the breakthrough infections for those who are fully vaccinated and boosted. So we need to be aware of that and need to continue those protective behaviors, those basic protective public health behaviors that we need to carry on. There are emerging treatments for COVID infections. They are often in short supply. If you are in the Atlanta area or in areas where there is a major medical center, teaching hospital, you may have more access to them, but certainly some emerging treatments for COVID infections, which are proving to be quite effective. Next slide, please. Now, here's what you can do to stay healthy during this pandemic. Hand washing. I know we started with that. We began with that. We need to continue with that. Proper wear of face masks. I do recommend, and I don't believe it's just because I had 2 assignments at the Centers for Disease Control. Their guidance is really quite good. It is revised regularly. It is science-based, and there's lots of information that will support all of us in making decisions about the type of face mask, when we wear a face mask, and especially the proper wearing of the mask. And I won't get into all of the issues related to mandates related to masks or vaccinations. But the proper wearing of those masks is very helpful in preventing the spread of COVID-19 virus. Social distancing, also very important. That is incredibly important when we are indoors. And since we are in cooler weather now, colder weather now, more of our gatherings are indoors. And so we really need to have that distancing, those face masks, and that hand washing, those behaviors in place. And then sanitizing those frequently touched surfaces, particularly if they're at school, at work, and then being very mindful of those surfaces when we're out at the grocery store, the pharmacy, wherever we have to go. And then, those vaccinations, those boosters are so important. We need to really get our questions answered about those vaccinations. Which ones are they safe? They were developed too quickly, and they actually were not. Um, Also, I also had two assignments with the Food and Drug Administration, and one of them was in the Center for Biologics, which is the center which reviews the submissions for approval of new vaccine, and the rigor with which those reviews are done. Leaves no question if you're able to look at that process closely, as I and many others have had the opportunity to do. We have we have either the most or one of the most robust regulatory systems that reviews, so that when a vaccine is approved for use, even emergency authorization use, they are safe and effective. If they can't pass those bars, they will not be approved for use in this country. And as a matter of fact, there are some other vaccinations that are used in other countries that either were not or chose not to apply for approval in this country through our regulatory system. Next slide, please. One of the most important things you can do in protecting your health in this pandemic is getting reliable information from trusted sources, and then making your decision regarding getting vaccinated if you have not already been vaccinated. I cannot stress more strongly the importance of getting that information from reliable sources. There's information on CDC websites, academic medical centers such as Emory University, through the Surgeon General's office. The Surgeon General there's actually a Surgeon General's report, which is available on the Surgeon General's website, of information on misinformation, the kinds of misinformation that are causing folks to not trust the vaccines and to make the decision to not be vaccinated or to delay vaccination. And quite frankly, if there are pre-existing conditions with an individual and they are not vaccinated, they are the ones who are having the worst outcomes, and are the ones who are often, they're most likely to be the ones to be hospitalized and have some very serious outcomes. I was reviewing some statistics today for an awareness campaign, and in one hospital here, more than 80% of the individuals admitted for COVID-related infection to that hospital were unvaccinated, not vaccinated, but unvaccinated. And those three other ways, those other ways that individuals can stay healthy during this pandemic is to get, in addition to getting reliable information and making your decision to get vaccinated if you're not already, is to get your mask, wear your mask, and to live your life. Because we can still do many of the things we like to do, even during this pandemic. And we need to continue to do that. We just need to make wise decisions, wear the mask, get vaccinated, and continue on. And I probably moved through that a little faster than I had anticipated. I'd like to know if you have questions for me. I don't promise to have answers, but I love forums where I'm able to field questions and either tell you what I know or tell you I don't know, and that's one I'm gonna do a little research on. I do see a question regarding should men take mammograms every 2 years as well? I did think about adding some content to the slides about the fact that breast cancer does occur in men as well. So it is worth an assessment during exams to make sure that there's not a change or a difference from from year to year. And if there is a change, then there does need to be an assessment, perhaps a mammogram, depending on, but that's definitely a conversation to have with your provider, especially if you notice a change, because we should know our bodies well enough to know what's changing from year to year, what looks different, what feels different, and have that discussion with that primary care provider. I can see the question, so I don't have a problem with just jumping in and going after them. The types of oil that I recommend are, and the nutritionists recommend. One of my references was a registered dietitian who actually is a clinical dietitian who co-teaches with me quite a bit to senior groups here in the city. Pre-pandemic, we haven't done much of that since we haven't done any of that since the pandemic. Her recommendation and my recommendation are consistent. Olive oil, extra light virgin olive oil, avocado oil, vegetable oil, as opposed to oils that are not vegetable based. And if that doesn't answer that question, and they're depending on what you're cooking and the temperature that you need to get the oil up to, the label directions will guide you as to how high a temperature that specific oil, whether it's olive oil or avocado oil, will tolerate. Even peanut oil. At what age are colonoscopies no longer required? I have not seen a recommendation that doesn't include that gives an end age for colonoscopies. It is not the most pleasant, stress-free procedure you'll ever have, and there will probably come a time when the individual, as they get older, may decide to defer jointly, hopefully, with their primary care provider. They just, especially if they don't have a strong family history, that they don't want to carry that out anymore. I have seen individuals in their 90s choose not, without a family history, choose not to do that. I'm gonna have to look back at that again, but I don't recall seeing a guidance that had an age end for colonoscopies. As far as how much sleep is recommended, the standard answer is usually 7 hours, 6 to 7 hours. But again, as one gets older, one does require perhaps a bit less sleep, but probably more rest. And then as far as how much rest, and you should be able to judge, whether you're getting enough rest and sleep by how tired you are, based on your activity level during your activities during the day. And your activity level during the day is also going to dictate that, how much rest and sleep you need. You may need a bit more if you're more active. How active are you during the day? What's something, let's see, how much vitamin D? I'm going to hold on that vitamin D question because I need to see if I have that in my notes somewhere. Somebody always asks me that question. What's something that I wish the 60 plus community knew sooner about their health before reaching 60? Diet, exercise, and watching the weight. And some of it is probably stress, the amount of stress that they're under. Just keeping on monitoring that. It's a little easier if we manage that weight and get control of that diet when we're younger than when we're older. That answers that. There's one there I'm not sure I understand. Let me go to the next one. Let me hold that one too. How do I feel about multivitamins? I do think if one has a balanced diet and can tolerate the foods they need, especially fresh fruits and vegetables, there may be less need for that. But since our absorption may be a little less efficient as we get older, a multivitamin might not be a bad idea. I mean, I do know that a primary care provider is probably going to be on one side or the other as to whether or not those multivitamins are of value, but it's not. But with those multivitamins, supplements, what I do find some individuals engage in is if a little bit of this is good, a whole lot is better. And if it's a water soluble vitamin, you're basically not doing anything, but you're not doing anything but wasting the funds for that multivitamin or those supplements, because your system is simply not going to absorb that much of an overage of some of those nutrients in the way of supplements. Samples of proteins other than beans in a whole foods based diet. Beans, legumes. My personal healthy go-to meal is a salad with a little tuna on it, and a dressing I make up myself with a couple of ingredients, tomato sauce and light mayo. So just a little protein and then vegetables. And then for breakfast, it's an avocado toast. I've really gotten into avocados. And there's a question about supplements that are good to combat memory loss. And I'm thinking I need to defer that one to one of your future speakers who may have some suggestions in that area. And let's see. I think I've touched all of them that I can. Linda and Kevin, can you see the last one?
No, I don't. Well, the last one I see is the supplements relative to memory loss.
And the one below that?
It says yummy.
As yummy. I think it was about your avocado toast.
Oh, okay, got it. Okay, got another question in. Is it safe to take a pill or a shot for osteoporosis? I think again, if you're referring to the injections that are given for related to osteoporosis, I've seen that recommended by healthcare providers, but I've also had, depending on the medication, if you're having dental work done, there's something about the regeneration of tissue, especially if it's dental implants, related to some of the medications for osteoporosis. So that's a primary care provider, and if you've got an oral surgeon, you're going to have some extensive dental work. That's a discussion that they need to have. That actually happened to me, and I had to defer that medication because I was having a dental implant, and there was some concerns about, and from the research and some in the literature on both the part of my primary care provider and my oral surgeon as to regeneration post implant surgery. And that I did not know, but I learned that the hard way. Okay. Other questions? I mean, I just like to just finish by saying, unless there are other questions, is to, we can be healthy. I'm probably, I think I am, and I meet more people my age and older, including my siblings and my 93-year-old mother, who are feeling great. They work at eating well, getting some exercising, getting their rest, paying attention to the stress level, So it's, the best does come as we get older. There are things that just, often don't bother us anymore. We often have a little more free time. We often have a little more choice in what the activities we engage in. Often have a lot more time for leisure, relaxation, fun, travel. Life is good. And you want to keep enjoying that good life. So we got to take care of ourselves. And
Sorry.
okay, I got a question about my favorite posting. My favorite question. My favorite posting is the yummy. They're all great though. They're all great. But it's my pleasure to do this. Thank y'all so much for asking. Please, let's make sure I'm on the invite list for your future speakers. I'd really love to be a part of that as well.
Well, I think that's probably a given. So, well, I guess I'm not going to have that martini I was counting on tonight.
Well, you know what? These things are so much more fun if we can do them in person. I miss my senior groups that I teamed with my the clinical dietitian with to do these classes. And by the way, when I did these with AARP here in Chattanooga, and with a couple of other groups who were focusing on senior citizens, we partnered with the culinary schools in the area. There are 3 in the area, and the students got credit for. We worked with them to plan samples. So we talk about foods and nutrients and preparation style, techniques, etc. And the students were in the back of the room preparing all of the samples that we talked about. And then they politely handed them out. The students didn't have to take their final exam if they participated in that demo, but those are the best. So maybe we could do that. Participate, partner with a culinary school and do a full out nutrition. Nutrition is part of healthy aging.
Okay, well, Mary, thank you so much for joining us this evening. We really look forward to having you again, and you're certainly going to get an invitation. And I want to thank all of you for joining us this evening. I will send an email link, if not tomorrow, no later than Friday, to the video recording of the event. And it's also going to have a little, very small 10-question survey, and I hope you'll take a moment to fill it out. And I'll tell you why. Emory 60 Plus Network has been such a success that we're going to roll it out nationwide. And you can be a part of that by helping us understand what kinds of programming are relevant and of most interest to our age group. So please help us in that regard. And finally, my door is always open. There's nothing I like better than to hear someone's Emory story and help them connect to the rich culture of the Emory community. So I look forward to hearing from you, and I think you all have my contact information. So have a great evening. And again, thank you all so much for joining us. And thank you, Mary.
My pleasure.
Thank you.
Right there. That person.